I'm going to give you some example of how to use a toolkit that HANYS has developed, and I'm going to focus on specifically how to improve antibiotic use in your facility. And I'm going to give you some example of what we have done while working with several nursing homes in the Rochester area. So an example, when we started working with one nursing home, we obtained all their antibiotic use, and then we started to summarize them, and we realized there is a lot of quinolone use. However, we couldn't tell why they were using it because there were no documentation of an indication, dose, and duration. So without documentation of why you're using something, it's really hard to improve it. You would have to go back and collect the information. So it's recommended moving forward that every facility has a way when an antibiotic is ordered, there's always an indication, a dose, and duration. And it's understandable that sometimes you use antibiotic without knowing specifically what the infection is, but you could put, fever, suspect, pneumonia, or suspect urinary tract infection. That should be acceptable. And sometimes we use something, we prescribe it for 10 days, but we realize that, we're going to stop when the culture comes back. It's okay, but it's important to document the indication, dose, and duration. And so one nursing home that we worked with developed a prescription sheet that includes all this information that can be monitored. And so if it's not completed, then the pharmacist will come back and say, you need to complete this information so we have it in our system. And this is a nursing home that doesn't have electronic medical records, so the order had to be a paper order. And that paper order is present on the toolkit website. It's also important to improve antibiotic is to standardize, what's very easy to reduce the use is to make sure that people are not treating for too long. And now there's more and more evidence that treatment for common infection, is around 7 days. So it's important that you standardize the duration and have policy for treatment for common infections. So on the website, there's a lot of document on guidelines for treatment of UTI, for treatment of pneumonia, for treatment of skin and soft tissue infection that we have developed, and other sites working on improving antibiotic use have developed. There's also information on C. difficile treatment and assessment, and it's important to note now that the guidelines no longer recommend metronidazole as a drug of choice for the treatment of C. difficile infection. The other thing that you could do to improve antibiotic is to reduce the use of prophylaxis for urinary tract infection. There is really no strong evidence that that's very helpful in the population that resides in the nursing home. So in one nursing home, what we have done is we measured how many people are on prophylaxis over time, and we work with their facility to try to talk to families, to try to talk to urologists, which is a little bit difficult, but to try to reduce the number of people who are receiving prophylaxis, and that number is tracked over time. So whatever you do, I think it's important to measure and report, and provider like to see how they're doing compared to other, and like to see that they are making a difference and making a change.